Hello, I am Susana Gavidia-Payne, and I'm delighted to present Research Snapshot number 14 on behalf of professionals and researchers in early childhood intervention, otherwise known as PRACE. I am in Djadjawaran country and acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. I pay my respect to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples. Today, we're discussing the article Parent Perspectives of Ear Health and the Relationship with Children's Speech and Language in the Longitudinal Study of Indigenous Children, authored by Anita Morrow and colleagues. PRACE selected this article to highlight the impact of ear health concerns on the development of young Aboriginal and Torres Strait Islander children, particularly in reference to their speech and language outcomes. Otitis media is a common preventable childhood condition, affecting about 80% of children before the age of 3 years. This condition is disproportionately more prevalent, long-lasting, acquired earlier, and more severe and complicated among Aboriginal and Torres Strait Islander children than non-Indigenous children. The research in this area provides conflicting evidence. A recent Australian study with Aboriginal and Torres Strait Islander children found that children with otitis media at age 6 years had typical language development scores at age 6 to 10 years. However, they presented a small negative relationship between bilateral otitis media at 6 years, showing limited receptive vocabulary at age 10 years. The hypothesis is that periods of auditory deprivation caused by otitis media during a critical period of cognitive and language development results in delays in speech and language acquisition. Using a strengths-based approach, the Footprints in Time Longitudinal Study of Indigenous Children, otherwise known as LSIC, has been collecting various health data from approximately 1,700 Aboriginal and Torres Strait Islander children and their parents in Australia in annual waves since 2008. The study authors are a group of Aboriginal and Torres Strait Islander and non-Indigenous researchers with multidisciplinary expertise and experience across Indigenous health, audiology, speech pathology, pediatrics, and education. The authors specifically wanted to explore one key question. What is the relationship between parent-reported ear symptoms and parent-reported concern about the child's expressive and receptive language skills? It was hypothesized that parents who reported no ear symptoms when the child was between 2 and 6 years old would be less likely to report concern about the child's speech and language skills at age 5 to 7 years. Based on previous research, variables called covariates in statistical terms were also investigated to determine if they had an impact on child speech and language outcomes. These variables including things such as sex of the child, remoteness, socioeconomic status, maternal education, and source of income, amongst others. A total of 787 children were selected from 11 communities across Australia, varying in levels of remoteness. Parent-reported ear symptoms, or colloquially known as runny ears, were used as a predictor variable, whereas parent-reported expressive and receptive speech language concerns were the outcome variables. The latter were measured using questions of the parents' evaluation of developmental status, or the PETS measure. The design used was a quantitative longitudinal cohort. The ear health information of children was collected at 2 time points, when they were approximately 2 to 4 years old, and then approximately at 4 to 6 years old. The two speech and language outcomes were measured 1 year later at around 5 to 7 years old. Data analysis was conducted using SPSS statistical software. Various statistical analyses were performed to investigate relationships between parent-reported ear symptoms and parent-reported expressive and receptive language concerns, after adjusting for all other covariates. LSIC obtained ethics approval for this study from the Australian Institute of Aboriginal and Torres Strait Islander Study, amongst others. Several key findings are important to note in this study. Firstly, 82.6% of parents reported no ear symptoms and concern about the child's expressive speech and language, whereas 95% of parents reported no ear symptoms and no concerns about the child's receptive language. A strong relationship was found between Aboriginal Torres Strait Islander children's parent-reported ear health in the early years of life and parents' perceptions of the speech and language skills 1 year later. Parents who reported the child experienced no ear symptoms in 2 consecutive years, aged between 2 and 5, reported lower concern for the child expressive and receptive speech and language aged between 5 and 6 years. Ear symptoms were a stronger predictor of receptive language concern than for expressive speech and language concern, although the proportion of parents reporting receptive language concerns was lower than for expressive speech and language concerns. Another important finding was that there was a lower prevalence of concern in remote living families, which may reflect cultural diversity in remote areas and the relevance of the parent evaluation of developmental status as a measure. Findings of this study can be used in several ways. First, it highlights the importance of the links between health concerns such as otitis media on Aboriginal and Torres Strait Islander children's expressive and receptive language outcomes. The study findings have implications about how to work with young Aboriginal and Torres Strait Islander children. Practitioners need to consider cultural and linguistical diversity as well as cultural safety in all aspects of speech and language measures. For example, interviews, standardized measures, etc., as well as programs and interventions. Further, effective support for Aboriginal and Torres Strait Islander children and their families requires services to be family-centered and strengths-based across health and speech and language supports, just as this study was conducted. In this context, it's particularly important to consider the National Best Practice Framework for Early Childhood Intervention currently underway, which has cultural safety for Aboriginal and Torres Strait Islander children and families as one of its key principles. It emphasizes the need to have practices and assessments that are culturally safe and support children's strengths and identities. You can see here some useful links to resources and related topics, ranging from the Footprints Time Study, which this current study we have been discussing forms part of to various national strategies focusing on the health, development, education, and well-being of Aboriginal and Torres Strait Islander children and families. Here is some information about the researchers who authored this article and the citation of the research article. Thank you very much for listening.